neurophysician, isn't it? Not psychiatrist. Earlier it was there. In before 18th century, 17th, 18th century, usually the patients with the apasmara or the epilepsy, the psychiatrists were treating. Now it has the neurophysicians are treating the epilepsy because of it is the psychosomatic disorders. It is not a psychiatric disorder. In the same way, this concept already told by Charaka in the 5th BC itself. Because when there is a manoroga, there will be a agantuja vyadhi. But here there is no agantuja. Chatvaro apasmaraha. Only 4 apasmara, no, not 5th one. Charaka in the Sutrasthani explains Chatvaro apasmara. Only 4 types of apasmara. There is no 5th one. Generally we are telling that is agantuja apasmara. Generally in other textbook we will see. But now, classically if you study Chatvaro apasmara, only the 4 types of apasmara. There is no 5th one. Whereas, come to the Unmada or Graharoga, there is a Unmada is of 2 types. One is Sharirika, second one is Agantuja. That's why the Unmada is only the disease considered under the heading of Manoroga. And some textbook, what we see, Atattva Vinivesha. Do you heard this word? Atattva Vinivesha. What do you mean by this Atattva Vinivesha? What do you mean by Atattva Vinivesha? Consider? Right. Which is right, they are thinking wrong. Which is wrong, thinking right. One word. Atattva Abhinivesha. Okay. Some of the textbook, Atattva Vinivesha is also explained as a independent psychiatric disorder. No, it is not a independent psychiatric disorder. It comes under Unmada itself only. It is also a part of Unmada only. If you study Unmada, all the diseases comes under this heading only. Unmada, apasmara, whatever it is. All the conditions will come in this only. I will tell you how it is. Why this Atattva Abhinivesha is included, apasmara is also included means Unmada, it means Unmadam, Punar, Mano, Buddhi, Samjna, Jnana, Smriti, Bhakti, Sila, Chesta, Achara, Vibhramam, Vidya. What do you mean by Vibhrama here? What is the meaning of Vibhrama? Vibhrama, its meaning is perversion. Perversion means thinking right to wrong, wrong to right. You understand this? Which is right, that to be thinking as a wrong. Which is correct, it should be understanding as a wrong. Which is wrong, understanding it as a right. That is perversion. Here, when the 9 factors will get perverted, this condition what we call as Unmada. In an individual, all the 9 factors are perversion, it is very difficult. Among these 9, one is perverted, it is considered as Unmada only. If Mana is perverted or Buddhi is perverted, that perversion of Buddhi itself is Atattva Vinivesha. Why it is considered as Atattva Vinivesha? The perversion of Buddhi. What is the functions of Buddhi? Samam buddhirhi pashyati. It means what? Samam buddhirhi pashyati. Sarvasthana explain. Samam buddhirhi pashyati. Understanding of things as it is, without any ignorance or without any illusion. If you are understanding, that is the normal buddhi. Samam buddhirhi pashyati. When the buddhi will get perverted, the individual start understanding the things in opposite way. That is, tattva means as it is, means opposite, abhinivesha means understanding. The understanding of things in the opposite way, that is atattva abhinivesha. That's why the buddhi vibhrama among this Unmada, only the one condition we can consider as the Atatva Vinivesha also comes under the heading of this Unmada only. The 9 factors is not perverted in all the conditions. Among these 9, 1 is perverted, it is considered as Unmada. Again, somewhat the important factor here. The Acharyas told Bhutagraha or Bhutavidya they told. Unmada is not told in the Ashtanga, isn't it? Bhutagraha or Bhutavidya. Isn't it? Kaya Bala, Graha Roga or Bhutagraha they told. But here Unmada you are telling this. See, Unmada again it is of 2 types. One is Agantuja Unmada and Nija Unmada. Where there is a Nija Unmada, it requires Yukti Upashraya and Daya Upashraya and Sattva. Whereas the Agantuja Unmada, what is second heading, that is purely psychiatry in Ayurveda. It is the Unmada heading, if you consider, it is psychosomatic disorders. If you consider Graha Roga or Bhuta Vidya or Bhuta Graha, it is purely psychiatry in Ayurveda. Do you understand this point? It is purely psychiatry. Why it is? What do you mean by Bhuta Graha? What it is exactly? Bhuta Graha means what? Bhuta Graha means, in Ashtanga it is explained, Lakshaye Jnana Vijnana Vak Cheshta Bala Paurusham. Purusham apaurusheyam yatra tatra bhutagraham vade. It means what? Lakshaye jnana vijnana vak cheshta bala and paurusha. Among the 6, one is having beyond the capacity of normal human being. For example, I can talk the 3 to 4 languages. If I start talking in the Persian language, it is the abnormality. You understand? You heard many concepts you will see, isn't it? The individual is having its own capacity. When individual is having how much he has to work, bala, isn't it? Vyayama or bala. Individual, when he start doing the work beyond the capacity of normal human being, that what we call it as Bhuta Vidya or Bhuta Graha. Bala, Chesta, activities beyond the normal individual's activities. Vak Chesta, Bala, Paurusham. That is Lakshay, Jnana, Vijnana. Knowledge. In this level, how much knowledge you should have. Beyond this, if you have, that is, IQ concept is different here. Do you understand? IQ concept is intelligent quotient. That concept is, see, the child is having 110 IQ, one more child is having 140 IQ. 140 IQ, it is not abnormality. That is the genius, that concept is different. But here, beyond the limitations of the normal child or normal human being, if he is having knowledge, for example, who doesn't know the language or 3rd standard student, 2nd standard student, he start reading or the English papers without interruption, that is abnormality. To understand why it will be happen, how it will be happen, this is because of the subconscious mind is getting all the things and it is accumulating. When the subconscious mind will be existing and the conscious mind will go back, subconscious mind will be existing, such activity and such languages will start coming out. This is the modern concept what it does. Here also the Acharya has given the same description. Okay, Jnana Vijnana, in this concept the Acharya has given. For understanding I told you, conscious and subconscious mind I told you for your understanding. But here Acharya himself told the Jnana Vijnana Vak Chesta Bala Paurusha. These are when it becomes beyond the limitations of normal human being, such condition you have to call it as the Bhutagraha. Here it requires some treatment, isn't it? It requires some treatment. You have to think there is some abnormality in that particular the human being. And Here Bhuta means generally what we call Bhuta means what concept we have? Bhuta means Deva. ನಾವೇ ಎಲ್ಲ ದೇವಗಳು ಇಷ್ಟು ಜನ ನಾವೇ ಎಲ್ಲ ಒಂದು ದೊಡ್ಡ ದೇವಗಳು. ದೇರ್ ಇಸ್ ನೋ ದೇವ, ದೇರ್ ಇಸ್ ನೋ ಭೂತ. We are the Deva, we are the Bhuta. Isn't it? Why it is? The Bhuta, it is having Bhutanas Chaturvidayonihi Jarayuja, Andaja, Svedaya and Outbija. The Acharya has given this description. There is no ghost or there is no Bhuta. There is no Deva. Isn't it? It is Bhutanas Chaturvidayonihi Jarayuja, Andaja, Svedaya and Outbija. There is no Bhuta, there is no Bhuta. See, why it will happen? Because of this Lakshay Jnana Vijnana, what I told. When it becomes abnormal, beyond the limitations, the meaning, the concepts in paper, we have seen. In earlier also we are getting. In Punjab state, one child who doesn't know that language, but he started talking that language frequently. The family members become the how he doesn't know this language, how he started. Because of the subconscious mind is accumulating all these things, and when it will be existing, it will be exhibiting. That is abnormality. For this, it requires the treatment. Here in Apasmara, it will come Apasmaram Puna Shruti Buddhi Sattva. These three already we have seen in Unmada, isn't it? Shruti is there, Buddhi is there, and Sattva. In Unmada also they told it these 3 points, isn't it? Unmadam, Punar, Mano, Buddhi, Savdya, Jnana, Smriti, Bhakti, Sila, Chesta, Achara, Vibhrama, Vidya. But here Acharya what he told? Smriti, Buddhi, Sattva, Samplava. See, this terminology is very important. Acharya use the word Vibhrama, that is perversion. Here Samplava. What do you mean by Samplava and what do you mean by Vibhrama? Vibhrama means perversion. Samplava means impairment. What we can say? Impairment. That is time, only time being it will get affected. These three will get time being the Smriti Nasha, Buddhi Nasha, Sattva, that is Sattva Nasha, that will be a temporarily, not permanent. Here in perversion it is totally abnormal, totally there is a loss. But here Samplava meaning is temporarily. In which time? When the patient will get attacked. During the attack only the patient will lose these three Smriti, Buddhi and Sattva. When the patient will come out of this problem, when he will get the conversion, he will get the, or he will lose the Smriti, Buddhi and Sattva. When he becomes normal, he will come out with the attack. Again, the Smriti, Buddhi and Sattva will be the normal. But this condition is not in Unmada, but it is in Apasmara. That's why the Acharyas told it is not a psychiatric disorder, it is a somatic disorder. It is an impairment only, not permanent. There is a disability of this, or totally there is no loss. But time being it will get disturbed. Again, the patient will regain these three factors. Whereas in Unmada, once it is perverted, that is a permanent. It requires to make the correction. It requires long treatment for the inner patients. Okay. What are the general etiological factors? See, many diseases will come. That is not important. Acharya told in the Sutrasara also. For Sharirika Vyadhi itself, he told, you don't treat or you don't think or you don't become panic or don't become shy if you don't know the name of the diseases. By Lakshana you have to treat when you are not able to understand when you are not able to diagnose the disease. What is that quotation? Vikara nama kushalo na jiviyat kadachana. Acharya has given the statement. Vikara nama kushalo na jiviyat kadachana. Nahi sarva vikaranam namato asti dhruvastitihi. It is for somatic disorders itself the Acharya has given the instruction to the physician. In the same way, for mental disorders also, the many patients will come with complex the symptoms will come. If you diagnose it as a anxiety, no, it is not anxiety. If you are diagnosing it as a depression, it is not a depression. These symptoms are also present. These symptoms are also present. Many other, the other one, that symptoms also present. The many the disease symptoms are seen in the patient. In that condition, you don't confuse, don't become panic to diagnose. Consider or keep in the mind the etiological factors commonly, usually 2-3 general factors, the common factors will be there. But if you go through all the samhitas of the Ayurveda, you can find the many etiological factors. Among this, the first one is Istasya, Alabha, Labhasya, and Istasya. What we need, we will not get. What we don't want, that we will. You understand? I need this, I will never get. I don't want this. Again it will come and it will follow us. This is the important and first factor. See, when the patient will come, you go and asking the patients. Put on the questions to the patients. They will not tell all the things. Try to hide actually what is the problem. Isn't it? They will not tell that what is actually problem. Go on asking the questions. Go on asking the questions. They will come. One fine day they will tell you what exactly the behind it. Why he or she is doing like this, they will tell. Isn't it? Immediately they will never tell the truth. The patients will always having this tendency. They will try to hide the complaints. No sir, they just usually in somatic disorders itself, the patient, they are telling lie. Since how many days you are having the joint pain? Sir, 5 to 10 days. See, he or she is not able to sit and stand. Within 5 days it is possible. It is of minimum more than 5 years of history. Then only it will be the symptoms. Isn't it? More than 5, minimum more than 5 years, then only such condition will come. But what they will tell? Only 5 to 10 days. No, don't believe it. Don't believe it. Try to put the questions repeatedly. You try to put the question. One fine day they will tell what actually they have. What is the problem? What is the inner feelings of the patients? For this, in the classroom also many classes also I told you. You have to keep the two important torches in our pocket. One is Dhyana and Buddhi. By keeping these two torches, don't keep this torch, the mobile torch. In OPD, you don't keep this mobile torch or some other torch. You keep in your pocket Dhyana and Buddhi, two important torches. Manas explain this. Dhyana Buddhi Pradipena, Yona Visheti Tattva. Aturash Antaratmanam. If you want to understand the internal feelings of the patient, use these two important terms, Jnana and Buddhi, by intellect and your knowledge. What the knowledge you gain by textbook and the teachers and elders, that knowledge and your intellect, by using these two important terms, examine the patients thoroughly. Don't believe on investigation. Examine the patients, then diagnose the patient, diagnose the diseases. These two are the very important, the thoughts you have to keep examining. What it gives, Aturash Antaratmanam, Nasarogam Sikitsda. Nothing will be remain blank if you are using these two torch. Everything you will get by using these two torch. If you are using this torch, nothing you will get. If you use these two torch. That's why, to understand Istasya, Alabha, Labhasya, and Istasya, what we need, we will not get. What we don't want, that only we are getting. That is the one of the important, the cause for the mental disorders. Isn't it? Second one is Dhaya Shoka. These are the basic factors. Usually, patients are telling, commonly they are telling, why the fear? Fear. What is this fear? Ask them, why fear? What is the fear? Put on the question, you will understand. But these are the basic factors only. They are not a disease. But in Shishur Samhita, they told as the independent diseases. Even though, but they are not a disease, they are the only the basic factor for Manoroga. And then Ahita Anna Pana, that is Rajasa, Tamasa Ahara, Viruddha, and Ashita Bhojana. These are also a very important. It's having directly influence on the mind. Isn't it? This Ahita and the Rajasa Tamasa Bhojana, which is explained in the Bhagavad Gita 17th chapter, Rajasa Ahara and Tamasa Ahara. If you are following this, see now you are in this campus. For 5 days at least you will never get Rajasa and Tamasa Bhojana here. I know. Isn't it? The same conference if you conduct in a hall, in outside or in city, evening again we will go for this Rajasa and Tamasa. Morning we will attend the conference, evening again Rajasa and Tamasa Bhojana we will take. Isn't it? That's why we are conducting at least 5 days, you should not come the relation with this Rajasa Tamasa. Here Sattvic Ahara only. Near in front of the Lord Buddha, you are getting the good food. Within 5 days, 1 year what you have done, within 5 days it will become the Shuddhi. 100% it will become Shuddhi, no doubt. That's why the Rajasa Tamasa Bhojana, you will never come to the here 5 days at least. At least 5 days you will be free from Rajasa and Tamasa. It is very happy to say all the delegates. Next, one more the important factor is related to Ahara. Next, Khinasya Testa Vaishamyam. What do you mean by this Khinasya Testa Vaishamyam? Inferiority complex. See, this is very important among the mental disorders. Inferiority complex. What is this inferiority complex? Considering others' improvement, if you are showing the jealousy, see, he or she achieved that much, but I have not achieved, isn't it? This is a jealousy. Try to reach more than that level. You put the effort, put the sincere effort, hard work, sincerity, regularity. By this you can achieve. No. Only if you are not following this, only the jealous. If you are the showing inferiority complex among the others, that will causing the mental abnormality. Isn't it? Many patients will come. When you start practice, you will understand. These factors you have to keep in your mind. When the patient will come, one or the other way, definitely they will come under this category. Other than this, there is no any other reason for mental disorders in the universe. That is, inferiority complex, important. Then, Dhanakantadi Nashe, loss of the near and dear relatives, near and dears, and Dhana means loss of wealth. Isn't it? This is also one of many questions will come. ಯಾಕೆ ಚಿಂತೆ ಮಾಡ್ತಾ ಇದ್ದಿಲ್ಲ ಯಾಕ್ರಿ ಇಲ್ರಿ ಸ್ವಲ್ಪ ನಮ್ಮದು ಪ್ರಾಪರ್ಟಿ ಇದೆಲ್ಲ ಇತ್ತು ಲಾಸ್ ಆಯ್ತು ಇದು ಕಾಮನ್ ಇದೆಯಾ ಆಗ್ತಿಲ್ಲ ನನ್ನ ಪೇಷಂಟ್ಸು ಕಮ್ಮಿ ಇತ್ತು ಬಟ್ ಇದನ್ನೇ ಮಾಡ್ತಾ ಇದ್ದೀವಿ ಸರ್ ಒಂದು ತಿಂಗಳಾಯಿತು ಬರೀ ವಿಚಾರ ಮಾಡ್ತಿರ್ತಾರೆ ಏನಂತ ಹೇಳ್ತಾ ಇಲ್ಲ ಯಾಕ್ರಿ ಏನಾಯ್ತು ಕೇಳಿದ್ರೆ ಇದು ಸರ್ ಒಂದು ಸ್ವಲ್ಪ ಪ್ರಾಪರ್ಟಿ ಇತ್ತು ಸಿ ಧನಕಾಂತಾದಿ ನಾಶೆ ಆನ್ ದಿಸ್ ದ ಲಾಸ್ ಆಫ್ ವೆಲ್ತ್ in any form it is, in any form. But if you analyze These are the terminology in Sanskrit you are saying, but practically if you implement in a patient, when the patient will come, you ask, you put these are the symptoms, the etiological factors you have to keep in your table, just analyze it. Among this, one or two, definitely they will come and they will tell their problems. Dhanakantadi Nathe. Next, Prakarshanam Deva Guru Dvijanam. This is also a, see, in Atang Hridaya, we have explained this concept. Unmada Karana, in the etiology of Unmada, the Acharya is Prakarshanam Deva Guru Dvijanam. If you are opposing the God or the teachers of ancient days, they have that capacity, isn't it? You have seen that many mythological, you heard and you have seen the mythological stories in a TV channel and in books also you have read that. When the student has learned, if he is not obedient to the teachers was giving the shapa, you should ignore all the knowledge what I have given you. Isn't it? By giving shapa itself, the student is ignoring the knowledge what he has gained during those days, not now. Isn't it? Nowadays, this trend has changed. Isn't it? The teachers are also not having that capacity of giving shapa, and students will also not learn in that way. That's why the 5 days why you have tied up here is, again you should come in that system of the knowledge, that the knowledge you should get. But here we are not giving, anybody are not giving shapa to you. 5 days you have tied here, we are not giving shapa. Isn't it? But we will, again happily we will send you, you should get more knowledge. Next time you should not sit here, you should come here. It is our, from my side I am for every student I am saying, next time you should not sit here. When the next conference will come, you should come here, you should give the lecture to your junior, next who are coming. Isn't it? You should like this, you should not like this. But nowadays also the teachers are giving the shapa to the students. In what way? Oh, he is not asking mind, he is not obedient, he is not coming obedient regularly, he is not attending the classes. Okay, the examination will fail him. This the teacher will do nowadays, isn't it? But he is not a teacher. Who will do such things, he will not a teacher. Who will do this in examination or in personally, if you have the grade, who is doing to the student, he is not a teacher, he is a cheater, isn't it? He is not a teacher, because you should not show your intelligence in the examination, you should show your intelligence in the classroom. I am telling all the colleagues, my juniors, my teachers in my colleges, so I am a dean of feedback. Whenever I will take the classes for them, I will tell you should show your intelligence in the classroom, not in the examination, not in either. You take them to the hospital, bedside, to show your intelligence. Then the students will give, then students are respecting. Not here, in outside also they are respecting. Isn't it? You show your intelligence in this way, not in other aspect. This you have to understand. Isn't it? Now, the Deva Guru Dvijanam, Prakarshanam Deva Guru Dvijanam. If you have the quarrel with the teachers, God. Quarrel with God means if you are not following the spirituality, that is only you can consider it is. एकस्य शून्ये अवस्थाने It is also mentioned by Ashtanga Hridayakara in Bhutanmada Prakarana. These are all the economical factors mentioned by the Acharya. Ekasya Shuddhe Avasthane. It means sitting in one place. That is loneliness. Many the patients, many individuals, they have this tendency. They don't want to mingle with others. They don't want to talk with others. They doesn't have any friends. Isn't it? It is also one of the cause for the mental disorders. If you go on practicing this, loneliness, no relation, no friends, no the social life, if you are sitting alone, just to see, 10 days you can practice. You don't talk with your friends, you don't talk with any relative friends. Sit in only one place for 10 days, what you will feel. Within a 10 days if you feel, some of the individuals, they have this tendency, Ekasya Sunne Avasthanam. They are sitting, they want only the loneliness. This is also one of the cause for the mental disorders. And Ratir Avidi Sevanam. What is prescribed for us for daily routine activities? If you are not following this, Acharya told, Brahmi Murte Thaya. It means what? Early morning, 7:30, you have to awake. 4:30. No, it has same time. Because up to 12:30, 1 o'clock, we see the mobile. How it is possible to awake at 4:30? Impossible, isn't it? Brahmi Murte Uthaya, at least 7:30 early morning. The time you have to change it here only. Isn't it? Early morning, 7:30, you have to awake. Isn't it? Not 4:30. 4:30. If you are not following this, not now. Now you have mobile, you are watching the mobile, night chatting, everything. Then late night you are sleeping by 12:30, 1 o'clock. Early morning 7:30, you are waking. And what are the routine activities told by the Acharyas? In the Dinacharya and Ritucharya, if you are not following, we are not getting anything now. After certain age, you will understand. You only feel that I have not followed this. I have not followed this. Even though I am Ayurvedic doctor, I should tell others. But myself, I have not followed this. I have done the mistake. Isn't it? You are feeling within short time, everybody, you are feeling this. Because, I will take this example. Everybody is this problem. Mobile, TV and everybody is this problem now. Okay. At the age of 40, the patients will come with the joint pain. Have you seen in your practice, in your OPDs, in your hospital OPD? I have shown to my students, many patients of 35, 40 years. ಅಕ್ಕಿ ಕರ್ಕೊಂಡ್ಬರ್ತಾರ ಸರ್ ಈಗ ನಮ್ಮ ಸಶಿಸರು ಕಾಲು ಹಿಡ್ದ ನೋಡ್ರಿ ಅಂತ. That old lady is 76 years. She will bring her sister-in-law, sir. ಇದು ಒಂದು ತಿಂಗಳ ಕಾಲು ಹಿಡ್ದ ನೋಡ್ರಿ ಅಂತ. See, this is the what that old lady has followed. Pratyek Avidi Sevanam, she has done properly. At the age of 76 also, she was healthy. She is not followed this. At the age of 35, she started joint pain, the calcium deficiency. At the age of 30 years, 35 years, calcium tablets start. Isn't it? What is natural calcium? What is natural, the food it is there, that we are not giving importance. Only we are depending on the medicines because of this. And one more important, Ashwini, sir. The Rajasa, Tamasa and Viruddha Ahara. These are also important. These are all the contributing factors for this component, somatic and psychiatric problems. And Ashitip Devatarchari Parasutaka Sankaraha. What is this Parasutaka Sankaraha? Usually after death. Isn't it? We have some Sutaka for 10 days. According to their customs, they are different. Isn't it? Here, the three categories will come here. One is strong believer, one is strong opposer, one more group nor believer nor opposer. One who is having strong opposer, he is not believing anything. What is the whole idea? They will never get any mental abnormality. Who is thinking of much, who is following 100%, he will also not get any the problem, because he is following this properly and he will do that, he will become normal. Nor believer nor opposer. 80% of the people, 10% strongly believer, 10% strongly opposer of this. They will never get problem. Nor believer nor opposer. Munde iವರು ಹಿಂಗನೋದು ಇವರು ಹಿಂಗನೋದು ಆಮೇಲೆ ಯಾವುದು ಫಾಲೋ ಮಾಡೋಂಗಿಲ್ಲ ಅಂಥವ್ರು. Such individuals, 80% of the individuals are having this problem. Parasutaka Sankaraha. If you go to the Ashtanga Sankara, you will understand this problem. Then Homamantra Bharijnana Vibhunam Parikarmacha. Whatever the things are prescribed for us, if you are not following in proper way, Homa, Mantra, Bhari, etc., you have to do that in proper way. Tomorrow you are having Homa here, no? It should be in the proper way. If you are not following the properly, it causes the abnormality. Again here, it is not causing any abnormality. That Homa doesn't causing any abnormality. Your mind is causing the abnormality. Who is sitting for Homa, he is telling, see, anything will happen after Homa, next day or after 10 days, 15 days, anything will happen. He is telling, hey, Homa ಮಾಡಬೇಕಾದ್ರೆ ನೀವು ಸರಿಯಾಗಿ ಮಾಡಲಿಲ್ಲ. Because of that you are getting this problem. That start is the repeating in his mind. Oh, he was telling, he told that I have not done it properly, that's why I am getting this problem. When we start thinking repeatedly, that is causing, not Homa is not causing the abnormality. Your mind is causing the, your mind itself is causing the abnormality. I told you no, not believer, not opposer. 10% who is not believing, ಮಾಡಿದೋ ಆಗುತ್ತೆ ಏನೋ ಆಗೋದಿಲ್ಲ, ಇನ್ನೂ ಮಾಡಬೇಕಿಲ್ಲ. Very next day again he will call and he will do it properly and he will become normal again. Not opposer, the strongly opposer, strongly believer, 10% they will never get. This 80% nor believer nor opposer. ಮುಂದೆ ವಿಚಾರಕ್ಕೆ ಬಿಡೋದು ಆಮೇಲೆ ಮನೆಗೆ ಹೋಗಿ ಒಬ್ಬರೇ ಒಂದು ಹಿಡಿದ ಅದಕ್ಕೆ ಹಂಗೆ ಆಗ್ತಾ ಇದೆ ಅನ್ನೋದು ಮತ್ತೆ ವಿಚಾರ ಅದನ್ನೇ ವಿಚಾರ ಮಾಡೋದು. This is causing the abnormality. That is Homamantra Bharijnana Vibhunam Parikarmacha. The mind which is behind it, that is only the cause. Not these are the factors directly behind. And last one is the drug induced psychosis. Many drugs having the abnormality, the abnormal action on the mind, they causes the psychiatric illness. Next. Here, what are the general symptoms? See, not disease, individual disease I am not going, the general symptoms. What will be? Dhivyabramaha, Sattva, Paripravascha, Paryakunaha, Dishtiradhiratacha, Avadhavakyam, Hrudayam cha Shunyam. What is this Hrudayam cha Shunyam? What is this Hrudayam cha Shunyam? What is this Hrudayam cha Shunyam? House surgeons, final year? House surgeons? No house surgeons. Final year? Hridayam Shunyam means what? Who is reading Hindi books? Just raise your hand. Hindi books, Hindi textbook. Translated Hindi textbook. Please raise your hands. All are reading Samhita only. Very good. In Hindi textbook, they have given Hrudayam Shunyam. It means emptiness of the heart. What is the meaning? Emptiness of the heart. Where is heart, he don't know. How it becomes empty, he don't know. Isn't it? But he has translated as it is Hrudayam Shunyam. In quotation. Next, in Hindi explanation or English translated, Hrudayam Shunyam means emptiness of the heart. What is this emptiness of the heart? It is not emptiness of the heart. Hrudayam Shunyam means the individual will lose the feelings towards the relatives, elders, friends, everything. You understand this? You understand this? Feelings towards the relatives, friends, and the others, neighbors, society. If anything will happens, next, small injury to him, immediately what we say? Immediately we will ask. This is the feeling. That feeling will lose. That is Hrudayam Shunyam. Just general I am telling this. Everybody is having this feeling. But patient who is having this abnormality, the psychiatric disorders, they will lose the feeling. It means anything that happens, they don't show any feelings towards the others. Either positive or negative, whatever it is. At least they will not tell, ಒಳ್ಳೆಯದಾಯ್ತು ಅವ್ರಿಗೆ ಆಗಿದ್ದಂತೂ ಅನ್ನಂಗಿಲ್ಲ, ಹಂಗೆ ಆಗಬಾರ್ದು ತಪ್ಪಂತೂ ಅನ್ನಂಗಿಲ್ಲ. What is point? This feeling when he will lose, that is known as Hrudayam Shunyam Samanya Unmada Dadashalingam. These are the Samanya Unmada Lakshana. Then with the three intentions, see here, I told, these are all the etiological factors we have seen, isn't it? The many 18, 19 etiological factors we have seen. This, the patients come with us, you analyze one day, 10 days, months together if you analyze. The patients have with the three important intentions only, they will having the psychiatric illness. You take any psychiatric disease patient, any psychiatric patient, go to any psychiatric hospital, analyze hundreds of patients, but they should, all the 100 patients should fall in these three categories only. Among these three, one will be the cause behind it. What is the cause? Is Dvividam Dukham Unmada Karanam Bhutanam Unmadana Prayojanam Bhavantihi Tadyatha Himsa Rati and Abdarchanam Cheti. Himsa means to afflict the injuries to the others. Inadru with intention, ಬೇರೆದವರಿಗೆ ಒಂದು ಕೆಳಗೆ ಮಾಡಬೇಕು ಹೇಳ್ಕೊಳ್ಳೋದು. ಆ ಉದ್ದೇಶ ಇಟ್ಟುಕೊಂಡು keeping that in the mind, he is showing the symptoms. When he starts doing the abnormality, the others will show the courtesy towards it. Isn't it? With that intention one. Second one is Rati. That is Rati, its meaning yes, someone should pray him. That comes under again Abdarchana, Puja Kama. Rati means to fulfill the desires. He or she wants to fulfill the desires, they are showing the symptoms. That is Rati Kama. Puja Kama means everyone should show the affection towards his or hers. Everyone should show the love and affection towards the patients. Keeping this in the mind, with these three intentions, among these three, one intention will be there, they are start doing the abnormalities. The cause will be 19, among this one will be the cause behind it. Isn't it? The reason is, there are only the three. Other than these three, there is no nothing. If you want to make injury to the some others, or if you want to take the revenge to some others, if I go in normal way, it is not possible. Then that will become under himsa kama. He is having such a tendency, he is developing such tendency with him. Others, what they then he will do the, or he will take the revenge. That is himsa kama. Second one is rati kama, that is to fulfill the desires. There is some with the desires they have. To fulfill that desire, they are showing the symptoms. Third one is archana kama or puja kama, that is everyone should show the affection towards the. Here senior students are not there, sir. This also not there. Next batch, some students I have shown the many patients of the Hubli city. One lady who came with severe the numbness and pain of the upper limb. She is not able to lift. She is having lot of weakness. In Hubli city, they have shown all the neurologists, the cervical MRI work, then venogram they have done, venous study done, venogram with MRI they have done, brain MRI they have done, and the neurological, the EMG they have done, everything will be normal. And the neurologist has given the treatment. Neurologist already treated 3, 4, 6 months they have given the treatment. The methyl carbamide, etc., etc. The what medicines they require for neurological problem they have given, but no relief. One fine day they come to our OPD. I asked the lady, since how many days you have this one? Sir, since 6 months I have this problem. What is your problem? Sir, only the pain starts from this shoulder up to the joint. Always there will be a numbness. I am not able to hold the even small vessels at this. Since how many? 6 months. Before that, if you have any this problem, no sir, 6 months ago. Why in 6 months only you have to see? It is not a question of a physician. You should not ask. Why in 6 months only you got this problem? I ask the question. Actually, it is not a question. I should not ask. But I ask the question. Why within 6 months only you got this problem? Before 6 months, where are you? Sir, ನಾನು ಮದುವೆಯಾಗಿ 5 ತಿಂಗಳಾಯಿತು. ಇಲ್ಲಿ ನಮ್ಗೆ ಹುಬ್ಬಳ್ಳಿಗೆ ಮದುವೆ ಮಾಡ್ಬಿಟ್ಟು ನಾವು ನವಲಗುಂದವರು 5 ತಿಂಗಳಾಯಿತು. ಇಲ್ಲಿ 18 ಜನ ಇದ್ದೀವಿ ಸರ್ ಮನೆಯಲ್ಲಿ. ನಮ್ಮ ಅತ್ತಿ ಇದನ್ನೆಲ್ಲ ನನಗೆ ಕೆಲಸ ಹೇಳ್ತಾರೆ. ನವಲಗುಂದ ಇದ್ದಾಗ ನನಗೆ ಎಲ್ಲರೂ ಭಾಳ ಅಚ್ಚ ಮಾಡ್ತೀವಿ ಸರ್. ಒಬ್ಬಕ್ಕೆ ಮಗಳು ನಾನು ನಡಿ ಅಭ್ಯರ್ಚನಾ ಕಾಮ ಎಲ್ಲರಿಗೆ ಭಾಳ ಏನು ಮಾಡ್ತಿದ್ದೆ ಸರ್. ಇಲ್ಲಿ ಬಂದಮೇಲೆ ಈ ಪಾತ್ರೆ ತೊಳಿ ಇದನ್ನು ಮಾಡಿ ಎಲ್ಲ ನನಗೆ ಹೇಳ್ತಾರೆ ಸರ್. ಇದು ಯಾವಾಗ ಸ್ಟಾರ್ಟ್ ಮಾಡಿಲ್ಲ ಸರ್, ಅವಾಗಿಂದ ಒಂದು 75% ಕೆಲಸ ಕಡಿಮೆ ಆಗಿದೆ ಸರ್. ಮತ್ತು ನಮ್ಮ ಅತ್ತಿ ಮೇಲೆ ಯಾರು ಹೇಗಾಡಿ ಸರ್ ಅದನ್ನು ಒಳಗೆ ಆಗಿಬಿಡ್ತೀವಿ. ಯು ಡೋಂಟ್ ಟೆಲ್ ಟು ಮೈ ರಿಲೇಟಿವ್ಸ್ ಐ ಆಮ್ ಡೂಯಿಂಗ್ ದಿಸ್. Actually, I don't have any problem. Understand, they have exposed to all the investigations. I told her, see, it is your mistake. You told, then they have to get to doctors. You should have some other ideas. They will not expose you. Isn't it? ನೀವು ಮುಂಚೆ ಆ ಟೈಮ್ ಮುಂಚೆ ನನ್ನ ಹತ್ರ ಬಂದರೆ ಅದು ಕಳಿಸ್ತಿದ್ದಲ್ಲ, ನೀವು ಡೈರೆಕ್ಟ್ ಮಾಡಿ ಕಳಿಸ್ತಿದ್ದೀವಿ ನಾವು ಅಲ್ವಾ. 6 months ಆಮೇಲೆ ಎಲ್ಲ ಇನ್ವೆಸ್ಟಿಗೇಷನ್ ಆದಮೇಲೆ ಬಂದಿದ್ದೀವಿ, ಆದಮೇಲೆ ಹೇಳ್ತೀವಿ. See, in these conditions, many patients have said. One just example only I told you. Like the Archana Kama also, Rati Kama patients were also having the same. With some, see, I told you, with some intention. There is no any other problems. actually she doesn't have any reason. I told you, in many cases, patients have to give the placebo. I given some tablets from our college. A soothsayer tablet for ಕೊಡಿದ್ವಿ 15 ದಿವಸ ಕಡಿಮೆ ಆಗ್ಬಿಡ್ತೈತಿ. 15 ದಿವಸದಾಗ soothsayer tablet ಕಡಿಮೆ ಆಗುತ್ತೆ. She methylcobalamin and other medicines, they have given lot of medicines, she doesn't get relief. By soothsayer, if she will get relief, definitely she will get relief. ಕುಡಿಸಿ the heading what I told, psychotherapy, that is sattva. What we have done now, half an hour, the treatment with sattva. Then I told her, see, it is your body duty, you have to do that. Whenever you will get the problem, you have to tell the elders. You don't do such things. It is not a good thing. See, in future you have life. Now only if you start doing this, yourself you will lose the career. I told him everything. Then she started adjusting to the work. By soothsayer only 15 days, she get 50% relief. They will come with their relations. Sir, 50% relief is not to say. See, this is the one intention. They will come and they have some intention. The psychiatric patients will come. That you have to find out. I told you, Jnana Buddhi Pradipyana, that's what I told. You have to examine with these two parts, not by any other investigations. Next. Among these three important Himsa, Rati and Abharchana Kama, the Himsa Kama is emergency in Ayurveda. Why it is? Because of the Himsa Kama patients is having these symptoms. Agni Pravesha, Jala Nimarjana, Salachava Agri Patati, Kasta Chasa Adya, and lastly they will try to suicide. You understand this? The Himsa Kama, patients with the Himsa Kama, they are emergency in psychiatry in Ayurveda. They requires the third line of treatment. Upashreya, Sattva-Jaya, and Daiva-Upashreya, what they told. Mani Mantra Dharana, what I told. That is Bandhana, Veshtana, what we explained in that category. For this patient, along with Nitya and the Sattva-Jaya Chikitsa, the third treatment is also important in the Himsa Kama patients. All the three techniques we have to use for the Himsa Kama patient. It is a psychiatric emergency in Ayurveda. See, we are telling there is no emergency in Ayurveda. Psychiatric emergency is there. Himsa Kama, in heading, if you go through the Charakas and the Shushrutswami in Ashtanga Hridaya, you will get the many descriptions. The Acharya Tippanikara has given a lot of description about this Himsa Kama, how it is emergency, why it is emergency, how to treat it. In step by step they have given a lot of description regarding the Himsa Kama patients. For all the conditions, Swakarma is Karana. I told you, no? Just example I told you. Our Swakarma is only the Karana. ಹೋಮ ಸರಿಯಾಗಿ ಮಾಡಲಿಲ್ಲಪ್ಪ ಅದಕ್ಕೆ ಹೀಗಾಗಿದೆ ಆಯಿತು ಮಾಡಿದೇವ ಮಾಡಿ ಮುಗಿದೋಯ್ತು ಅಂದರೆ ಮುಗಿತು ಸ್ವಕರ್ಮ ವಾಟ್ ಐ ಹ್ಯಾವ್ ಡನ್ ದಟ್ ಈಸ್ ಓನ್ಲಿ ದ ಕಾಸ್ ಫಾರ್ ಆಲ್ ದಿಸ್ ದ ಪ್ರಾಬ್ಲಮ್ಸ್ ಯೂಶುವಲಿ ವಿ ಆರ್ ಬ್ಲೇಮಿಂಗ್ ದ ಅದರ್ಸ್ ದೇವ್ರು ಹಿಂಗೆ ಮಾಡ್ದ ಶನಿ ಹಿಂಗೆ ಮಾಡ್ದ ಗುರು ಹಿಂಗೆ ಮಾಡ್ದ ಶುಕ್ರ ಹಿಂಗೆ ಮಾಡ್ದ ಎಲ್ಲರೂ ಯಾರಿಗೂ ಯಾರು ನೋಡಿಲ್ಲ. They will not give any problems. What we do the karma, what it is prescribed for us. Brahmi Murti at 4:30 you have to awake, they told, isn't it? Morning 4:30 if you are not awaking, you are telling Surya Bhat Karastikatandre Naga, Surya ಒಂದು ಬೆಳ್ಳಿ ಸೂರ್ಯ ಮಾಡಿ ದಾನ ಕೊಡಬೇಕು. ನೀ 7:30 ಬೆಳ್ಳಿ ಸೂರ್ಯ ದಾನ ಮಾಡೋ ಸೂರ್ಯ ಏನು ಮಾಡಬೇಕು ಪಾಪ. You awake at 4:30, do the exercises, so karma you have to do. What they told, you have to follow this. What Surya, what he will do? Sun will never do anything. Isn't it? He will give power to you. Isn't it? So karma is only the cause for the mental disorders. Unnecessarily we are blaming the other. That's why the Acharya straight away told, Naiva Deva, na Gandharva, na Yakshaha, न पिशाचः न राक्षसः न चान्ये स्वयं क्लिश्यम् उपकृष्णान्तो मानवम्. Nothing will be comes avesha in the human beings. ನೋಡಿದ್ದೀರಿ ನೀವೆಲ್ಲರೇ ಮಸ್ಜಿದ್ ಒಳಗೆ ಇರೋಲ್ಲ ದೇವರ ಬಿಡಿಸಿ ಕರ್ಕೊಂಡು ಹೋಗ್ತಾರೆ. Have you seen? No. Nothing will be entering anybody's body. There is nothing. Only the thing behind it is swakarma is only the karana. No deva, no bhuta. I told you, bhutanas chaturveda yonihi. Jarayuja, andaga, svedana, avbhija. There is no bhuta. There is no deva, there is no rakshasa. Nothing. ಎಲ್ಲ ನಮ್ಮ ಹತ್ರನೇ ಇದೆ. ಸ್ವಕರ್ಮ is only the cause. That's why Acharya told, na devah, na gandharvah. ನೀವು ಗಂಧರ್ವ ಬರ್ಕೊಂಡ್ರಿ ದೇವ್ರು ಬರ್ಕೊಂಡಿದ್ರಿ ದೇವ್ರು ಬರ್ಕೊಂಡ್ರಿ ಕೆಲವು ತಿಳಿದಿರಾ ದೇವ್ರು ಬಂದ್ರೆ ಏನು ತಿಳಿದಿರಾ ದೇವ್ರು ಬರ್ಕೊಂಡು ತಿಳಿದಿರಾ ದೇವ್ರು ಬರ್ಕೊಂಡು ನೋಡಿದ್ದೀರಾ ಕರ್ಕೊಂಬರಿ ಅಂದ್ರೆ ಯಾರಿದ್ದಾರೆ ದೇವ್ರು ಹೇಗಿರ್ತದೆ ನೋ ದ ಪಿಶಾಚ ನೋ ರಾಕ್ಷಸ ನೋ ದೇವ ನೋ ಗಂಧರ್ವ ದಟ್ ಇಸ್ ನಥಿಂಗ್ ಇಟ್ ಇಸ್ ಲೈಕ್ ಓನ್ಲಿ ಅವರ್ intellectual blasphemy, that is prajnaparada. Acharya will not explain the next prajnaparada sambhute vyadho karmaja atmanah navi samshuddhide devan na pitran na rakshasan. ಏನೋ ನಮ್ಮ ಸಿಸ್ಟರ್ಸ್ ಏನೋ ಮಾಡಿದ್ರೆ ಅವ್ರು ಕಾಡ್ಲಿಕ್ಕೆ ಆಗ್ತಾರೆ ಯಾಕೆ ಸತ್ತೋಗ ಅವ್ರು ಯಾಕೆ ಆಡ್ತಾರೆ ಇದ್ದಾಗೆ ಕಾಡಿಲ್ಲ ಅವ್ರು ಸತ್ತೋಗ ಯಾಕೆ ಆಡ್ತಿದ್ರು ಆಯ್ತು ಅಲ್ವಾ ದೇವತೆಗೆ ಅವ್ರು ದೇವ್ರು ಯಾಕೆ ಆಡ್ತಾರೆ ಅವರು ದೇವ್ರು ಕಾಡ್ತಿದ್ರು ದೇವ್ರು ಅಂತಿದ್ದೀವಿ ಅವರಿಗೆ ನೋ. That's why the prajnaparada sambhute vyadho karmaja atmanah, the karma swakarma vyadho karmaja atmanah. Atmana means the self what we have done with our swakarma will get the diseases by our own intellectual blasphemy. By prajnaparada we will get the disease, not by anybody's influence, by external influence. In the general treatment of neurology, the ideal treatment of mental disorders are aimed on mitigation of the symptoms, eradication of the disease, and the third, it is very important, is personality development. See here, if you take any other sciences, symptoms are reduced. They will reduce the dosage for 1 month. Again, the patient will, the symptoms are increased. Again, they will increase the dosage. Many patients, the psychiatric patients only come to me every day from different psychiatrists. I have seen in private OPD. I have seen many cases. But here, only the mitigation of the symptoms is not a treatment, or by eradication is not important. If you have done these two, for 10 years patient may alright, 5 years patient may alright. Again, such condition will come. Again, he will get this. The third important what you have to do in a patient is the personality development. This is very, very important. Nobody, the practitioner, is giving importance to the third factor. If you put into the practice no psychiatric, no somatic disorders, along with if you treat with the personality development, keeping this in the mind, if you treat no the diseases, no psychiatric, no somatic diseases. That's why mitigation and eradication. See, up to these two levels, also the Acharya stored for Sharika Vyadhi. Mitigation of the symptoms and eradication of the disease. By Shadupakrama, mitigation of the symptoms. By Panchakarma, eradication of the disease. What is that quotation? If you treat with Panchakarma, there is no chance of दोषाः कदाचित् कुप्यन्ति जिता लङ्घनपाचनैः जिता संशोधनार्थेषु न तेषां पुनरुद्भवः. Okay, eradication we have done, but it is for only the somatic disorders. When the patients come with psychiatry, the third important factor, what we told in Bhagavad Gita, there is 12 factors in 17th and 18th chapters. Important 12 chapters, 12 points they have explained. These are the make the personality development, putting these factors on a patient. If you have done the personality development, put into practice along with these two, there is no chance of recurrence throughout the life. Not only psychiatric, even somatic. That's why how it is Sattvam, Phal Prakashakam Vidhi, Rajaschapya Pravartakam, Tamo Niyamakam Pravtaha, and then these three are the factors, Sattva, Raja, Tama. Here the personality development means what? The question will come, sir, what we have to do for personal development? See, all the individuals having all the three gunas, including myself, everybody is having the three gunas, sattva, raja, tama are in our body, isn't it? Always the raja and tamo guna should be suppressed, sattva guna should be promoted. In this way, what we have to do, I told you, the 12 factors are explained in Bhagavad Gita 17 and 18 chapters. Sattva, Raja, Tama. Example I tell you, ahara related. Rajasika ahara, if you are practicing, the Rajaguna will go on increasing. Sattva ahara, if you are practicing, Sattvika guna will be increasing. Isn't it? If Sattva guna will be increasing, you are doing the Sattvika activity only. In Charaka Sutra Sthana also, he has given one quotation. एक चैप्टर इंद्रियोपक्रमणी है यद्गुणं च अवीक्षणं पुरुषम् अनुवर्तन्ते सत्वं तत्सत्वं योगविष्यन्ति मुनयो बाहुल्यानुशया इदिया यद्गुणं च अवीक्षणं पुरुषम् अनुवर्तन्ते when the individual sattva is coming to existing, he is performing sattvika activities and he is getting sattvika award only, isn't it? If such a tendency will go on increasing, this is nothing but personality development. When you eradicate the diseases, when you mitigate the symptoms, if you go on the practicing of this promotion of the sattva by different levels, ahara and the Shraddha, Bhakti, Karma, Jnana, etc. The 12 factors they are mentioned. If you are following all these factors in day-to-day life, your sattva guna will go on increasing. There is no chance of increase of raja and tamo guna. Then there is no question of any abnormality. These are only the positive factor for the disease, raja and tamo guna. When totally there will be a nil of raja and tamo guna, there is no chance of the aviksham purusham anuvartante. Raja guna will come into existing Rajasic activity, Rajasic award. No chance. Don't give chance to existing. Sattva only. This is the personality development. If you practice this in your life, after the in a patient also, in our practice you have to do that. In a patient you have to, after your treatment you have to do this development. This is the ultimate treatment for the mental disorder. Next. Why it is satam nirdosha akyatam kalyanam sattva rajaha sadosha akyatam rosham sattva tamaha punaha sadosha akyatam moham sattva. Ignorance and this rosham, these two are the qualities. These two qualities you have to suppress. The kalyanam sattva of sattva, if you go on increasing, that will give the positive health towards the psycho and somatic, both the diseases. Next now. Then what are the important technique players? Aitebhyo, Arthebhyo, Manonigraha. Aitebhyo, Arthebhyo means which is not suitable to us, that we have to avoid, isn't it? Which I follow this, it is giving some trouble to me. We know that. Then also we are doing that. Don't take Pani Puri evening at different places. We know that. Aitebhyo, Arthebhyo. Evening again we will go. See, we will learn in the classroom. We will understand everything, we will tell. Okay? You don't take the Pani Puri and this Puri, this that Puri, etc. Isn't it? Isn't it? Anybody will go? No. Those who are attending this conference, you are not going, I know, 100%. ಯಾರಾದರೂ ಒಬ್ಬರು ನಮ್ಮವ್ರು ಸಿಕ್ಕರೆ ಅವ್ರು ಕೇಳ್ತಿದ್ದಾರೆ ಹುಬ್ಬಳ್ಳಿಯಲ್ಲಿ. Don't take Satguru. You know this. Aitebhyo, Arthebhyo, Manonigraha. You should not take. Yes, sir, ಹಿಂಗೆ ಕೆಲವು ಹೇಳಿದ್ದಾರೆ, ಹೋಗು ಬೇಡ ಅಂತ ಹೇಳಿದ್ದಾರೆ ಅಂತ ಬಿಟ್ಬಿಟ್ರೆ ಓಕೆ. Aitebhyo, Arthebhyo, Manonigraha. Manonigraha, it is one of the important. You should not go. You should not take it. One important technique. Bhi Bhaira Atmadi Vijnanam Manodoshoshada Param. Bhi Bhaira Atma Vijnana, that is self-realization. See, what I am telling, it is not important. I may tell hundreds, thousands things. Okay. But Atmani Vijnanam, self-realization, what he told, whether it is truth or what it is. Realize it, you have to adapt, you have to cultivate. Atmani Vijnanam, that is it. That is one of the important the treatment of Manovijnana here. He Dhairatmi Vijnanam, Manodoshoshurapra. Then Manaso Jnana Vijnano, Dhairasmriti Samadhi. These are the important, one more important. And in 11th chapter, Acharya has told Manasam Prativaishityam, Trivarga Sharmavechanam, Tadvidya Seva Vijnanam, Atmadhyam Cha Sarvashaha. These are the, see, if you want to tell this quotation only, it requires minimum 3 days. Only one word is having is very important. Manasam Prativaishityam. The mental disorders itself having antidote. Manasam Prativaishityam. Trivarga here. What is this Trivarga? There is a 21 types of Trivarga explained by the Ayurvedic concept. 21 types of Trivarga. Only one word Acharya has told. Trivarga Shalmavekshanam. Only one word is the Anvekshana of 21 types of Trivarga. We have to make the Anvekshana. Trivarga Shalmavekshana. Tadvidya Seva Vijnana. See what you are doing here. Tadvidya Seva. Isn't it? This is also nothing but Tadvidya Seva Vijnanam. Atma, see, morning they have done this. This is also one of the, what they have done? Before my lecture. It is very, it's having its own importance. You don't know how much you are achieving, you don't know. But we having the capacity or not, we don't know. That's why we are avoiding that. That is one among this 21. One part only it will come. In such a 21, the Trivarga has told by Acharyas in a different, the clusters in different areas of Samhitas. If you analyze it, you will understand that with the Seva Vijnanam, Atmadhyamka Sarvashaha. You will become so Shuddha or so brave. There is no ultimate for this quotation. And Satam Upasana, Asatam Prevarjana, which is good for us, you have to follow, which is not good, you have to avoid it. Only one word they told. And following the right context. Sadhurta Palana, there is one of the important factor in our life. Okay, factors which are explained in Bhagavad Gita, I told you, and regulate Sattvic Ahara and reasoning. And lastly, in Charaka, Unmana Prakana Acharya has told, Pratidvandva Chikitsa. Pratidvandva Chikitsa means what? These are the diseases, they are the symptoms, they are the treatment. Pratidvandva Chikitsa. For example, Kama Krodham. Kama is also one of the mental abnormality. Krodha is also one of the mental abnormality. When the patients come with Kama, what is the treatment here? It should be treated with Krodha here. Here the Krodha will become treatment modality. But in some other cases, the Krodha itself is one of the disease and symptoms. Do you understand this? Kama Krodhena Jayante. The treatment will be like this. The patients come with Kama, the treatment with the Krodha. If you are doing the Krodha, by Krodha we can treat those who are having the disease comes with Kama, Krodhena Sanjayana. That we have to treat with Krodha. Isn't it? That's why this Pratidvandva Chikitsa is also one of the important in the medical practice or in psychiatric illness. With this view, the general concept, not the treatment, what are the different treatment, many Grita, Taila, etc. will come, it is not important. See, whatever that we are giving, that is not important. I told you, this treatment modalities, what the explained by Acharyas, if you are following one by one, definitely it gives the 100% result in the psychiatric illnesses. That's why in Ashtanga Yoga, in Ashtanga Ayurveda, Manasa Roga, it is also one of the important and independent branch. It was for Manasa Roga, it was the post-graduation was there in the syllabus. Now they have included in some other subjects. When I was the student, independently we have done the Manasa Roga in Kottakkal Psychiatric Hospital, 100-bedded hospital in psychiatry. What are the techniques we have seen here? All the techniques they were adopting in a patients. This bandhana, veshtana, etc. What it is there in our classics, everything they will do with our own eyes. We have treated the patients and we have took the training from that hospital. Many years I was there in post-graduation. We have seen the patients and we have treated. If you are putting the sincere effort, definitely the 100% the psychiatric patients without medicine you can treat the patients. In many patients I have treated. You can also try, and if you have if you got some knowledge with this, I am very much thankful to the organizer. I am also organizing secretary here. Especially I thank to our organizing secretary Dr. Saurabh, who has given this opportunity to speak few words along with morning the presidential session. I will thank all the delegates for patience listening. That is very important. If I have done any mistake while explaining, it is my mistake. If I have told anything, it is my teacher's blessing only. If I told any good things, it is my teacher's blessing. If I have done any mistake, it is my own mistake. Okay? With this, thank you.
The session is open for discussion and queries. So anybody have doubts or any discussion, you can proceed on with it. Later on, we'll continue with something other sessions.
ಎಲ್ಲ ಪಾಸ್ ಮಾಡಿ ಆಮೇಲೆ ಮತ್ತೆ